My name's Linda Dunn. I'm the Stroke Specialist Nurse for University Hospitals of Morecambe Bay Foundation Trust.
A couple of years ago, when we were involved in the regional Advancing Quality programme, at that time we were shown to be the worst performing trust, so we were at the bottom of the rankings.
We looked at our service and streamlined it. We went to our trust board and got some trust board engagement, and from there we were able to obtain 5 acute beds at the Royal Lancaster site on the emergency floor, which meant that we could transfer our patients from the emergency department to a stroke unit in a quicker time frame. The single biggest intervention that we can do for our patients is get them to a stroke unit within a 4-hour period. 3 years ago we were only achieving 13% of our patients reaching the stroke unit in that time frame. This year we've achieved 75% of our patients, so it's had a massive positive effect on them. All of the other data set, we're now achieving over 90% across the board.
Undertaking an audit helps to improve patient care, and by doing so, by collecting the data, clinical data items for every individual audit that we collect data for. So for instance, the stroke data, we would collect certain data items. We would then analyse the data, and by analysing the data we were able to formalise an audit report with the figures and the findings. And by recording the audit findings and reporting back month on month, we were able to target the areas where we needed to improve, and by doing so our patients are getting the correct care.
This will be the 3rd day I've seen her in a row, and I've seen a change in her in that time. This morning's brilliant. Yesterday afternoon when I saw her, she was really sleepy because she'd been having all this help and physio in the morning. But you can obviously see it's helping so much already. And everybody's just been really kind and helpful, and they treat mum so nicely. One of the nurses yesterday said she treats everybody here as if it was her mum or her dad, and that was really nice as well.
Well, I've gradually been able to piece it together with the help of neighbours and the police. First I heard about it was up in Cockermouth, the police knocking on my door to say that my brother was taken to A&E in Lancaster with a suspected heart attack, and to get down there as quickly as possible. So that was the Saturday the 18th of October, so obviously my husband and I came down here as quickly as we could, found him in A&E, and then learnt that it was a stroke, not a heart attack, and he was likely to be here for quite some time. And originally he was on ward 39, being very well looked after until he, a few days later, moved to the stroke ward, ward 23. And he's been very well looked after here. I've been here most days, not every day because I have a long journey and it's not always possible. But what I've seen, I think they're doing a very good job here. Yes, I haven't faulted anything at all while I've been here. I found them very pleasant, easy to talk to, and Malcolm feels confident with them. So I think that's the main thing, because he's very positive. And I think the staff are helping that as well.
This has led us to being 3rd in the North West this year, which is a massive improvement. There are many things that we want to do to improve our service further. We've had further investment from the Trust. We've got another 2 stroke specialist nurses now in post, which means that we'll be able to cover the A&E department and assess people for clot-busting treatment over a 7-day period, 365 days a year. It's about reducing risk, so by getting early swallowing assessments for our patients, we can reduce risks of aspiration pneumonia, we can reduce risks of people developing deep vein thrombosis by getting them mobilised earlier and getting physio and occupational therapy assessments done quickly. We can monitor them for signs of malnourishment by getting them weighed. All of these things, including the aspirin, the antiplatelet therapy, start and secondary prevention straight away, can improve outcomes for stroke patients and improve reduction in death and disability by up to 40%. We've also reduced our length of stay for our patients who are on the stroke pathway, so we've reduced that by 10 days, which means that our patients are getting home sooner, and the therapy is continued in the home environment where the therapy becomes real to them. Because of the improvements we've made, it means that our patients are getting the right care at the right time and being discharged home sooner.